talk about it.
Absolutely, we definitely agree with that, and I mean it's very obvious you have a long history of fighting for and supporting our children, and you touched on a lot of the points that we'll talk about today with our questions.
Okay.
So I'm just going to hand it off to Jessica, and I do want to just say to all of our question askers to if you can project, that would be awesome. So
that reminds me, my fourth grade teacher, Miss Callanan, I'm a big believer in the public schools. My mom taught second grade till she was 70. She had bright red hair, and when I was in fourth grade, she'd stand in the back of the classroom and she yell, "I can't hear you, speak louder." So it's a story of an influence of a teacher, but also how a lot of us get our start in politics. Okay, Jessica.
I am a mom and I'm married, and together we have 3 little boys. Our middle son has disabilities. He has a chromosome disorder, and he's ID. So we didn't find out until he was about a year old. I started noticing that he wasn't developing properly. He wasn't hitting certain milestones, so I started calling for help. The biggest thing is health insurance is so important for him. He requires physical therapy and speech therapy. He also does occupational therapy. He didn't walk until he was 2 years old, so he's developmentally behind. And so we originally started out at Title 19, working. We got up to Hawkeye. We were paying for Hawkeye insurance. And then when I got pregnant with my third son, I was too sick to work 40 hours a week. And so we fell back on Title 19. So there was a gap in between Hawkeye and Title 19 where I was taking him to therapy, and they were refusing to pay for the services. There's so many loopholes that we have to jump through to get him to therapy even now. Even when his insurance doesn't change, they have to call ahead and get like so many prior approvals for him to even be seen. And I've gotten calls an hour before therapy saying, "Oh, insurance still hasn't approved this, so you can't come in today." And there was another time when I was paying for Hawkeye and I missed a payment and I didn't know it, and they shut off Hawkeye on us. And because they shut it off, we had to completely reapply, and he went 3 months without health insurance. All of my kids did. And there was nothing I could do. I sat there and I cried, and I called and they said, "Well, how much would it cost me to physically pay for it?" And they said $400 for a 45-minute session. And obviously I didn't have that kind of money. So, and I've applied for the ID waiver, and I applied back in May of 2018, and I called last week to see, and he's still on the wait list, and the lady told me it's up to 3 years waiting period for him to just get. Essentially what it means is that he would have Title 19 forever because he has a chromosome disorder. He'll never get better in that sense. So
Yeah.
he needs therapy. He needs, he gets sick all the time. He has like a low immune system. So we're sick literally from November to April, we're sick. So it's scary. And I actually, I started working again after I had my son. And just last week, I got a letter saying that me and my husband have lost our insurance. We're no longer qualified for Title 19. We make too much money. So I'm really, really scared. January 1st, I will no longer have insurance. And I'm scared, what if I break my arm because I'm chasing the kids or something? Like, I can't go to the hospital. I can't afford thousands of dollars of hospital bills. And then now they're going back to Hawkeye. So what if I miss a payment or something? Things that you just worry about. And I've been looking for jobs that have good health insurance, and it's impossible to find one. And my son has therapy, so it's hard to find like a Monday through Friday 9 to 5 job that's going to let me leave to take him to therapy. Or if he's sick all the time, sometimes I can't do that. So right now I work opposite shifts of my husband as a server, just to get by. And when I got that letter, I almost called insurance, said, if I quit my job today, can I still keep the insurance? Because I don't know what else to do. And the biggest thing too is that if I quit my job, now we can't afford rent, electricity. All of this stuff is just so expensive, and we can't do it off of one income. But when we have two, all of a sudden we don't have health insurance. We don't get any kind of assistance at all, which it's not really the person I am. I prefer to just work, and I love hard work and showing where we've come from. But it's just like, what do I do? I'm so afraid for my kids. Like, I don't have health insurance. If I don't have health insurance, you know, my husband and I were to get into a car accident, like, what would we do? You know, we can't afford thousands of dollars of hospital bills, but my kids need, you know, healthy parents to take care of them. So I guess as president, what actions would you take to ensure that all children have health coverage and receive health services that meet their needs?
Well, first of all, I just want to thank you for what kind of mom you are. I love how it shows how you and your kids are one when you kept saying, we are sick through the whole time, because you live his life and you live your kid's life. And I mean, the first thing I'd say is just the love for a kid with disabilities. I saw that when our daughter was sick. She didn't end up having disability, but I got to know so many of these other parents through that time. And I got on that PACER board, which is Parents of Kids with Disabilities. It's a big organization based out of Minnesota, and have done a lot of work in this area. So my first thought is, I wish that, who's your congressman? Is it?
Cindy Axne.
Okay.
Cindy
Is it
Axne.
Signe? So just to start with that, I think trying to work, as I listen to this, like I can't help on that side because I'm out of Minnesota, and Cindy is so great. So seeing, it may be worth a call just to see if they can work through the details, someone on her staff. Senate staff too, you could try, but I won't go there. But and usually those offices are bigger, so you can get a little more expertise. But just seeing if there's some way to go through all of this, because the kids should be covered in this country for health insurance because of the Children's Health Insurance Plan. It's called CHIP, right? And so I'm trying to figure out, see if we have an answer in the back from no, they may know, because I'm trying to figure out how this works, that he wouldn't get health insurance when he should be covered by CHIP. So we need to figure that out and why this would be. Because my immediate thought is, as a mom, is we've got to solve your problem before we start talking about what I'll do as president. So you get some kind of help right now. So that's the first thing. The second thing is, this shouldn't be happening. We should make it easier. And as you know, your state, the governor of Iowa, and President Trump have made this so much harder. It's a series of sabotaging some of the protections that are in place on the federal level. Right now, as we speak, Donald Trump is trying to take people's Affordable Care Act protections away, as in you can't get kicked off your insurance for a pre-existing condition. That's something that's fundamental. It applies to everyone that's in that bill. And they're trying to change that. So I would reverse that immediately, drop the lawsuit, and then instead of sabotaging it, working to get more people covered. It's estimated that if you change that, you can add a couple more million people are going to be covered just by stopping the sabotage. It is also estimated that you can do a lot more if you expand Medicaid and stop this privatization and other things like you've done in Iowa, which have been a very bad experiment. So putting in incentives so you do a better job. The legislature, I see you're one of the great legislators back there. I know that they're working to try to do this. It's hard because the Republicans who run things right now are going the opposite way. So that's the second thing. Then the third thing I would do is just expand on protections for insurance. And this is not going to solve your immediate problem because I have to get elected, and that's not till 2020. But I think thinking about a future does help, because you think, okay, we could make this better. And that's expanding on the coverage under the Affordable Care Act with a nonprofit public option, which would bring the health insurance down for everyone and make it more affordable, doing more to expand on these safety nets that we're talking about for kids like your kid. I've got a whole policy on disabled kids and adults and what you can do to make it better in terms of coverage, in terms of IDEA and how that works in the schools, that I think could make your life a lot better. One of the things that I really hate is that there's been some bipartisan support on issues for people with disabilities. Everything from the ABLE Act, which allows you to save for your kid, which you're not even at right now because you're just trying to get by. But in the future, if things get better, that's something we did. Making it easier to get certain technology. I actually led a bill on that for speech altering devices to make it easier so they get covered, and that passed. But in a much bigger way, we've got to take on this health care and make sure it's available. That's why I favor this nonprofit public option, doing more to make pharmaceuticals more affordable by bringing down the price, by taking on the pharmaceutical companies, doing more when it comes to caretakers, and that would be for seniors and for people with disabilities, to do a $6,000 tax credit to help people who are actually caring for people with disabilities who are family members and things like that. So it's just a package of things. But I think the immediate thing is to figure out your story, and maybe we could figure out who your legislator is. Someone's got to help you here, because it doesn't make sense that a child would go without health insurance when we have this CHIP protections in place in our country. Okay?